So one of the things that I tend to do in explaining it is I say, look, it's not like your pair of glasses, top is far, bottom is reading. This one you're getting simultaneous vision through the system, and that requires some getting used to. It's not what you're used to in a pair of glasses. And then what I try to do in explaining to them multifocal is it gives you far and close at the same time, and your brain needs to sort that out. And so then once I fit them with the multifocal contact lens, I say to them, look, I'm going to see you next week. And I really do simplify that there's only 3 things I care about over this next week that I want you to pay attention to, which is how do you see far, how do you read, and are you comfortable? So I really kind of leave it very, very general so that they can tell me what's going on. And the reason I do that is because the patient experience is going to be different for every patient. So I don't want to, prejudice them.
That adaptation period in our education is in the demonstration, and when the patient has put the lenses on and they do have that relative range of vision, now we say the worst vision that you're going to have right with these lenses is right now. The vision will continue to get better as your brain and your eyes learn how to use these lenses to the maximum. So I want you to leave, I want you to experience the lenses in your normal everyday life, and I want you to adapt to them. When you come back to the office, if we need to make any changes, we can modify them to maximize your vision in your environment, not in mine.
I found that telling them about the design of the lens, that it's all there all the time and that your brain kind of sorts it out, it gives them that mentality of it's going to take a while for my brain to get used to this, and it makes them more patient.
Yeah, to tag on to that, and we haven't talked about this yet, is the understanding of what happens for the follow-up visits, the adaptation that goes on here. And there's a critical component called cortical adaptation that we have to understand, and we've learned this from the early days of monovision, where we would put monovision lenses on patients and they wouldn't work, and the patients would come back and they worked, depending on what our definition is. With multifocal lenses, it's exactly the same thing. Patients may not have as good a vision at their initial fitting as they do at their follow-up, because cortically, their brain and their eyes learn to how to use the lens. So being patient is another component that we have to keep in mind with these lenses to be more successful. Is it does not always work on the fitting visit. Sometimes we have to let the patient come back for follow-up visits and adapt to the lens and experience them.
The other thing that I do now, I say, number 1, I don't want you to play this game where you're alternating eyes. Number 2, I tell them, don't put your reading glasses over top of these contacts. I'd rather hear from you that I needed to move my arm or put more light on the subject. And the third thing I tell them, and I say this is the most important part, is even if you feel you're not comfortable with these lenses right now, when you come in for the follow-up, please be wearing them, because that's where we'll be making our adjustments. But when the patient follows those instructions, they're very well engaged in where it is that it's not working, and it makes it very easy to do the follow-up and to get them comfortable.
And to that point, Steve, I tell patients, you can come back and complain as much as you want, that's okay, but I want you to be descriptive. I want to know exactly where it's at. Is it okay out there, but it's not okay here? Is it okay here? And if somebody calls back before their appointment with issues, my staff is trained to say that same thing. Okay, now you need to work on figuring out exactly where it is so that we know how to change it. And the reason I do that is mainly because it changes their focus. They realize that it's a work in progress, that it's okay that it's not perfect, but that they're part of the solution, and that we'll get there.
One of the things that I would say about the exam room being the worst place to do to check someone's eyes, it's one of the things that I say to patients when I fit them with the contact lens for the first time. I tell them the first lens may not be perfect. That's okay. I'm not fitting you in your real life. I'm fitting you in a 13-foot dark room and telling you to go on your way. I expect you, when you come back next week, to tell me things that are working and things that aren't working. If you don't let the patient have a real-world experience with their contact lenses, they are not going to be happy most of the time. But once they have that real-world experience, they tend to be much better off. And they will come back sometimes with issues that need to be replaced. But the good thing is those are tangible issues that you can now work towards to make them happier.